And it's also time to say good morning to our...
Dermatologist.
I know what he is, but I was trying to find other ways to describe
Okay. You can
the
still
trouble,
try.
the trouble that he's in this morning by neglecting to remember his mother's birthday.
You mean you remembered and he didn't?
And he didn't. Can
I
you
wonder
believe
how
that?
you knew.
Good morning and happy birthday, Mom. Yes. Oh, look at that. She's a gorgeous lady.
She
Yeah,
is
she is.
lovely.
Yeah.
Tell us a
Yeah.
little something about your
Yeah,
mom.
it's my mother Joyce, the best mother in the world, and she has
Aw.
a twin sister Elsie. They're celebrating their birthday
Oh,
today.
that's lovely. That's
And she
lovely.
wouldn't let you tell us the number, right? She wouldn't
Yeah,
let.
she's in her 80s. She's
Okay.
in great shape. yeah, in
Fantastic.
great
Looks-
shape.
Still cooks?
Yeah, still cooks,
Yeah.
drives,
Lovely.
iPad,
Uh,
touchscreen phone.
well, probably goes windsurfing too.
Oh,
Working on that.
I suspect. And a twin, you know,
Yeah.
and they're around to share, you
Yeah,
know.
that makes it more
their
fun.
golden years there,
That makes
you
it
know,
more
tell
fun
all the
to
war
celebrate.
stories. I
Yeah.
wonder who that guy in the photograph was with her.
Well, it looks like her son
Just a
to
prop.
me. It looks like her son. Yeah.
Oh, okay, well,
Good stuff, though. Happy birthday to you. So we call her
And-
Mrs. Ford.
Joyce.
Yes?
Joyce.
Joyce,
Okay,
Joyce.
Joyce.
Joyce, you make sure you and
I
her
feel
sister's
odd
name, I mean,
saying
you
that.
know,
Elsie, I mentioned.
Joyce,
yeah,
Joyce and
Joyce
Elsie. Yeah,
Yeah.
I hope you got them something nice.
Yeah, definitely.
Okay.
Every year.
Okay,
Yeah.
all right.
Never forget.
Okay, we'll find out.
Better not. All right.
Okay, and before, let's talk about vitiligo.
Vitiligo
Mhm.
is an acquired depigmenting disease. It's an autoimmune disease, and it has significance because of the changes in the skin, and it's very obvious and causes a lot of psychic trauma to individuals who have it.
Psychic trauma.
Yes, it's disfiguring to have
Mhm.
your skin depigmented.
Okay.
What causes it?
Well, the cause isn't known because it's another one of these autoimmune conditions. And this first slide just shows that it can affect the mucous membranes. These are areas that you don't usually get here. So it can be the lips, the genitals, and other areas like that can also be depigmented.
Okay. Well, so does it start there, like where that
Well,
photo we
generally
just saw?
it starts on sun exposed areas. So
Okay.
any exposed area on the face, on the distal limbs, they're the most common areas. But it can also affect areas that are covered as well. And this shows you an individual with it on the face, and this is a
Right.
segmental vitiligo, where the vitiligo is actually on one side and it doesn't cross the other side. Those individuals usually have it in a localized area because vitiligo can be either localized or it can be generalized or it can be on one side of the body, which is called segmental.
You talked about exposure to the sun. Does that exposure have an impact on it?
Well, it does have an impact if you have vitiligo because you're more prone to sunburns. And if you can get sunburnt enough, then there's a possibility that you can be more at risk for cancers. But also sunburn is very uncomfortable. It causes redness and burning and that sort of thing. This one is to show you what's called trichrome vitiligo, where you get at least 3 different colors, because you can see the depigmented area in the center that's irregular. And you can see a lighter color, and then you can see a darker color. The skin's color and a darker color. Actually, there are 4 there. So that's one. When the vitiligo is starting to resolve, sometimes you get these varying colors within the lesions.
It resembles a healing burn almost.
Yes, some burns can cause a depigmentation, which is very reminiscent of vitiligo.
Is it more common in darker skinned individuals?
Well, it appears that way. It seems to be most common in India, but darker skinned individuals, it's more striking because of the change in the color.
Right.
But certainly, it's a common thing that affects at least 1% of the population. And here we can see it in a covered area. This is an armpit, but you can get it under the breast, you can get it in the groins. And of course, in lighter skinned individuals, it's harder to tell because the difference between the depigmented area and the normal area is not as marked.
Well, now I'm confused because you talked about it being more prevalent in the areas exposed
Yes, but
to the sun.
it can affect everywhere on the body. But of course, the areas that are exposed are more significant in the public. But it can occur almost anywhere, either symmetrically or asymmetrically, or just in a point. So the fingers are also common areas. The tips of the fingers, and you can see that marked change in the color there on the fingers.
Do you know why this happens?
Well, most autoimmune conditions, we have lots of theories, but no significant significant cause that we can definitely say is the reason why it happens.
How common is it here in Barbados?
Well, it's quite common. We see people with vitiligo every month. I'd say most people with vitiligo, it occurs, maybe 50% of individuals get vitiligo before the age of 20, so it even occurs in children. And by age 30, maybe 80% of the people that would have had vitiligo have it. And some that have it also have other autoimmune conditions in their families, lupus, thyroid disease, and other things. This is just showing you it on the elbows as well. And the little dots show you the hair follicles. If you have hair follicles that aren't white or depigmented, you have a better chance with your vitiligo because those hair follicles can provide islands of repigmentation within the
So you
lesions.
mean it can resolve itself? There are
Yeah,
situations?
it's very, you cannot predict what will happen with vitiligo. It's one of the more frustrating things to treat. Once you start early, you have a better chance of resolution. But it can get worse, it can get better, it can remain the same. It varies depending on how your body is coping with the vitiligo. And here it is on the feet, the distal legs, and also on the toes as well.
I think we talked sometime about some tiny white spots.
Yes,
This is
guttate
different from
hypomelanosis always causes a lot of grief and concern because it affects the limbs and their little confetti-like 1 to 3 millimeter depigmented areas. But with vitiligo, when you look at the areas with a Woods lamp, there's total depigmentation usually, and that creates it's like when you go into the disco fets with a strobe light, how the white comes out. Yeah, it looks like that.
So they're not related?
No, but it also shows that you can have a condition and you can get vitiligo secondarily, as this individual with discoid lupus has vitiligo within the areas of alopecia.
Why is the hair being lost?
Well, he has discoid lupus, but I was mentioning that there's an association. 20% of people with vitiligo also have another autoimmune disease themselves or within their family. So it's a reason to ask the patient about other autoimmune conditions.
So how do you manage your skin if you have vitiligo? Because you mentioned sun exposure can be an issue. How do you manage your skin?
Well, one of the important things is to prevent sunburn. So you have to cover either physically or with sunblocks or even with things to camouflage the skin. You want to avoid trauma because this condition also exhibits what's called the Koebner phenomenon, where if you get an injury, you can get vitiligo developing within it. So scratches and scrapes and injuries can result in vitiligo. But the treatments vary. Starting early is the key. After a year, it's difficult to treat vitiligo if you haven't started already. So one of the most common treatments involve using a corticosteroid application. There are also steroid-free anti-inflammatory applications and lots of use of light therapy, which seems paradoxical since light can irritate it. But they only use the ultraviolet B rays, and also they combine it with other medications, oral steroids. Well, again, when you find a condition that has a lot of treatments, it means that the exact mechanism and what works for the condition hasn't been elucidated completely.
So if you get a couple of spots, 2 or 3 little spots in your early 20s, should they be running to see?
Well, certainly, anytime you get depigmentation, you should go to see the doctor. And I didn't mention that the genitals are a common area that you can get it. So sometimes someone would have no signs of vitiligo, but just have depigmentation in the genitals, especially the men. So it's important to have it looked at. And if you start the treatment early, then you'd get some good results.
Well, how do you treat such a sensitive area?
Well, there are medications of the correct strength to be placed there. And as I said, once you start early, maybe in 6 months or a year, you can be resolved.
Does this have any physical effects? I mean, if you don't have something like lupus that you mentioned earlier, does it have any other effects? Does it feel different when you're being affected?
People with vitiligo are usually very healthy unless they have another associated autoimmune condition. So the only thing is that visual impact, and also, in Barbados, people tend to stare and watch you a lot if there's something obviously wrong with you. So that's the big problem with people with vitiligo. It's that cosmetic problem, so you can understand the need to camouflage it and to do other things with it. So there, again, just like some of the other conditions, there are many people on the internet who do a blog telling you about their life and explaining how they have to cover themselves up. And even some people who work in the media and on TV may have vitiligo and camouflage it every day.
Wow.
Oh. Doc, let me ask you, the areas, though, where the vitiligo turns up, are those areas any more sensitive than other parts of the skin?
Just sensitive to the sun, but not from a nerve standpoint with touch or anything like
okay.
that.
I was just wondering if they're more susceptible to cuts or to burns or anything like that.
And when vitiligo occurs in areas with where the hair is, like let's say close to the scalp, you can have a little white area of the scalp while the rest of the hair is black. So that's called poliosis, where you get
poliosis.
Yeah. Interesting word.
All right. Okay. Well, this is an interesting conversation. Sometime we must talk about the type of hair loss that affects everything, like anything, brows, and what is there a
Oh
special
yes, there
term
is
for
one that we did. I think we did do that one that was called alopecia areata, which is also another autoimmune condition which can affect your hair on any part of the body. So we've done it predominantly on the scalp, but it can affect. Some people have what's called alopecia totalis, where they're hairless. But that's of course an extreme situation.
Leads me to another condition, you know, that of albinos. And,
Yes.
And if there's any correlation between.
Well, it's a different mechanism, but albinism is something that's inherited or genetic. But again, they have the problem with the sun and sun damage, but it's from birth.
Right.
So you can imagine the amount of sun damage they would get over time. So that's one of the main causes of the basal cell cancer and other cancers in individuals who are really from African origin.
Right.
So you'd see those things. But we should also mention that there's some people who have such significant vitiligo that they opt to totally depigment their skin. And you know, this is actually, there are medical indications over a certain percentage of the skin being depigmented that, you know, they opt for not having any pigment at all permanently.
That is a safe procedure?
Well, of course, it's only done under medical guidance, but it is safe and it can be done so that the person won't have that great difficulty.
Excellent. Always good information shared. Thank you for helping us get into our skin, Dr. Ford. This morning we focused on vitiligo and a number of other related or maybe not so related things as it relates to skin and hair. We thank you very much for sharing.
Thanks.
And again, to Mama Ford, make sure you have a beautiful, beautiful birthday, you and Sister Elsie.